The Nigerian Association of Resident Doctors is on the verge of downing tools across the country. The reason? The federal government's failure to implement a previously signed Memorandum of Understanding. According to NARD, despite doctors suspending a 29-day strike on November 29th after the MOU was signed, the government has repeatedly failed to honor their agreement. The ball is now in the government's court. Will they act, or will the healthcare system be ground to a halt? That's a question on the lips of many. But let's get real. Nigeria's healthcare system has been on a roller coaster thanks to recurring strikes by the Nigerian Association of Resident Doctors since 2015. They've gone on 12 strikes since 2015, the longest one lasting a whopping 63 days in 2021. Now let's go and look at the timeline, the lowdown. 2015. The chaos began. The doctors at the University College Hospital Ibadan went on a 180-day strike, while Lautech medics laid down tools for 5 months. Funding issues and unpaid call duty allowances were the spark. In 2016, a 7-day national strike in June sent a warning signal. Residency training guidelines and salary issues were the problem. In 2017, more budget battles. A 10-day strike in September highlighted unpaid salaries and residency training funding woes. In 2020, COVID-19 brought new challenges. The doctors protested the lack of equipment and hazard pay, striking in June and September. In 2022, things got intense. A record 63-day strike, that's August to October, over massive arrears and death in service insurance. A 10-day April strike was just the start. In 2023, welfare fights continued. July 26 to August 12, the strike demanded a 200% salary hike. In 2025, TIC's 2.0 strike, that was November 1 to the 29th, over unpaid 25 to 35% arrears and Lokoja 5 dismissals. Guess what? Another strike is threatened for December, that's yesterday and today. Will this cycle ever stop? That's a question you might be asking. What do you think? This cycle of strikes, MOU, and broken promises has become all too familiar. The National Association of Resident Doctors, or the Nigerian Association of Resident Doctors, are demanding change. So would the government listen? I'm now being joined by Dr. Kevin Kwashak Yakubu, Second Vice President, Nigerian Association of Resident Doctors. Thank you for joining us.
Thank you. Good evening.
Thank
you for having me. Compliment of the season.
We were expecting that you would join us yesterday, either you or the president, but I understand you were part of a meeting in the bid to ensure that the strike doesn't take place. So what was the meeting like? Any updates?
Well, thank you for having me, and good evening to our listeners. Compliment of the season. Yeah, so thank you. I was the one that was supposed to join to you yesterday for some reasons. Like you rightly said, I was in a very crucial meeting to look at some of these issues. But, it's important to mention, to give a context to why even the meeting of yesterday took place in the first place. I was happy when I saw you giving a very comprehensive breakdown, and I'm very happy about it so that people understand where we're coming from and where we're headed to. Recall that 1st of November, we shut down, went on total strike that lasted for 29 days. This strike was called off. We resumed work 1st of December. Within those 29 days in November, series of meetings were held. Consultations took place. We reached out to a lot of stakeholders and all of that. There were conciliatory meetings that was called at the instance of the Minister of Labor, with all the other ministries, Ministry of Health, Accountant General, Budget, and all the people involved, all the stakeholders. Meetings took place. Agreements were reached. MOU was signed. Beautiful agreement. And then we all agreed with this MOU, there were clear and concise timelines. They were very unambiguous, ranging between 1 week to maximum of like 2 months, with just few exceptions that had those 2 months. Most of those MOU were sent out with the agreement within 1 week to at most 4 weeks.
Okay, we'll just pause there for a moment. We'll take a break, and when we come back, we're looking at the timelines. So what happened to the 1 week or 2 week timelines that now we're being forced to consider having to look elsewhere for medical attention? Details in a moment. Well, before we went on that break, we had the second vice president of the Nigerian Association of Resident Doctors, NARD, Dr. Kevin Kwashaki Akubu, in the studio. And before we went on break, you were talking about building a context. How is it that we got to this point? You got to a point where you're talking about there were 1 week timelines, 2 week timelines that were agreed on between the 1st and the 29th of November. So why are we here now?
Yeah. So why we're here is all about trust issue. You know, when you reach an agreement based on understanding, MOU, Memorandum of Understanding, it only expected of all the parties involved to honor those agreements. You know, unfortunately, it's very unfortunate that where we are as of today, those agreements were never honored by the government. When I mean by the government here, I actually mean the Ministry of Health, who is like our employer, you know, as doctors. Now, I give you a clear example. One of the major issues was the issue of sacking of 5 resident doctors from FTH Lokoja. It was among the 18 demands that we were pressing home, you know, during the TICS 1.0. We agreed with the government. First, even before that agreement, there was a committee that was set up by House of Reps, Committee on Tertiary Health Institutions, which looked at the issue entirely and agreed that these people should be reinstated in the same FTH Lokoja and be paid back all their backlogs of arrears. Again, ministry said they were not comfortable with that position. They set up, we agreed. They proposed and we agreed that they were going to set up another committee independent of that, of the House of Reps, to look at this issue. It was chaired by a professor, a board chairman of that hospital. And then they also recommended that these people should be reinstated with all their backlogs of arrears paid to them fully. When we came for signing, we agreed that this should be implemented within 2 weeks. Initially, we as NAT agreed that it should be 1 week. Government said, no, 2 weeks is good time enough for them. Today is 4 weeks. We have not seen any of them reinstated. We've not even started talking of payment of their backlog of salaries. So the point here is that government have actually failed from their own point of view, you know, in honoring this agreement. Okay, so and these are union leaders. What we heard, you know, and this is now taking me to the question you asked earlier, whether there was an update. Of course, there is an update, all right, because of the meeting we had yesterday. We just found out that government is now, the Ministry of Health is reporting elsewhere in some quarters, in some fora, that they have written letters to these people to be reinstated. But you know the problem? They asked that they should choose to be posted to another different federal institutions, not FTH Lokoja. And the question is why? The agreement was that they are returning back to FTH Lokoja. And the position of NADItes across the country is that these are union leaders and they only fought because of the welfare of their members, and they must be reinstated back to FTH Lokoja. And that is the position. We're not going back on that.
So if they are reinstated and then posted out, is that a problem?
Definitely there is. What's the rationale for posting them out?
If they reinstate them to FTH Lokoja,
yes,
and then post them out after reinstatement, is that a problem?
Why? It's a problem. It's a problem. So where the whole thing happened, they were working FTH Lokoja. They were not working elsewhere. The problem happened in FTH Lokoja. Problems have been solved. Why are you posting them outside FTH Lokoja?
Dr. Yaku, so now your government has failed. So you now want to fail your patients? Is that what you're saying?
We're not failing our patients. Look, this is not just the issue. We have to understand this very clear. There were 19 demands, all right? Out of these 19, there were just very few that were actually taken to finalization. Almost all were never taken to finalization.
How many were taken to final?
Probably, in fact, none. I may bold to say that. Because one that I can tell you, I should have said it has been taken to finalization was issue of excess workload, you know, and then the locum, employment of locum staff and all of that. We agreed again during that signing of MOU that a committee should be set up within 2 months so that they will go around the hospitals and look at whether these chief medical directors have complied with what was written to them. Till today, this is 1 month after the agreement. No one committee has been set up.
Okay.
We had another issue of specialist allowance and the entry point of resident doctors. Prior to now, a doctor who is coming in as a junior registrar enters at Comness 3, step 3, for some no reason. We don't know where the problem actually came from.
the Ministry of Health started issuing out waiver for employment to take in our colleagues at level 2, step 2, at complex 2, step 2. For no reason. We agitated. They said that the head of service will have to write. And we reached out to her. Fantastic. She wrote, advised the Ministry of Health, advised all the people involved that intake should be from complex 3, step 3. Till today, as I speak to you, Ministry of Health was supposed to transmit this approval to chief medical directors for implementation. That has never been done.
Dr. Yakubu,
the issues I can go over and over.
I understand. And if we do that, then we'll not be able to take on any other story.
Yes, definitely.
We want to thank you so much, Dr. Kelvin Kwashak Yakubu, Second Vice President, Nigerian Association of Resident Doctors. Now, thank you for coming in this evening.
Thank you.
And we wish you well and speedy
resolution. If you don't
resolution.
mind, let me use this opportunity, please, to thank some people who have actually helped in this fight. You know,
the DG of
the DG of the DSS has been very, very fantastic. You know, the Minister of Health who has also been helpful. The Minister of Labour has quite been helpful in this matter, and we're most grateful to them. We're open to negotiation, but if nothing is done, definitely this strike is inevitable, and then we're heading for this strike.
All right. Thank you so much.
Thank you so much.
Thank you.
Thank you.
Have a good day.